This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Good morning and welcome back to the Dental Up Podcast. I'm Bob Brandon, your host and the general manager here at Keating Dental Lab. What a great weekend. The NFL is finally back. The New York Football Giants won a game, not so much for the Jets. And out here in LA, the defending Super Bowl champion Los Angeles Rams lost their Thursday night opener, but the LA Chargers won theirs. And it still sounds weird hearing myself say LA Chargers, but maybe I'll get used to it in a few more years. And the modern day football team pitched another shutout, winning Friday night 35-0. And speaking of shutouts, Griff's team kicked off their second season of MLS Next with a 5-0 win, and they will get their test against LAFC in 2 weeks. Today's guest is Dr. Michael Miyasaki, one of the most accomplished and thoughtful dentists I have ever encountered. He practices in Sacramento, California, not far from our illustrious state capital. He's lectured worldwide and is gracious enough to come down to Southern California next month, October 21st to be exact, and share his knowledge with us. Today is just a preview. I want you to go to Keating Dental Lab's website or to the Vista Apex website for more details and to register for his course. It's October 21st, 8 a.m. to 3 p.m., 6 hours of live CE. Sign up quick. This course will sell out. Good afternoon, Dr. Miyasaki, and welcome to the Dental Up Podcast.
Hey, very nice to be here with you. Thank you very much for the invitation and the opportunity.
Oh, well, thank you. I want to thank you for agreeing to come down, and thanks for sending us this great case. We'll get more into that later, but you're going to be our guest next month, and I'm tremendously excited to host you and your family if you're going to bring everybody down, and it should be a really fun event.
No, Keating Dental Lab, you've been so great with education, and I really appreciate that. I think, today, especially you're bringing back that live component, and I think we're all kind of burned out with these webinars and things like that. The podcasts are kind of fun to listen to because you could do it while you're driving or whatever, but
sure.
Just personally for me, I watched a lot of webinars during those COVID years, and I don't know how much of it really stuck, but when we had that one-on-one opportunity, it's really great. And we had an opportunity to use your facility a few months ago when we worked with the Southern California chapter of the AGD, and we did a live surgery, sinus lift of like 9 millimeters using your facility and working along with Kevin. And I tell you, you guys do a great job, great hosts, and have a great facility. So whatever we can do to help our colleagues kind of grow in this profession, I think it's great. And the fact that you support them, not only through your dental work, but through the education side, I just want to applaud you.
Well, education's everything. I mean, we're all really to reach the pinnacle of any profession. You need to embrace the lifelong learning, model. And that's all of us. I mean, that's our management, that's our technicians. And, we send technicians to training, events at other companies and other labs really, so they can get better. And we all want to get better. And that's, the patients benefit from it. And as long as, if we're ever satisfied with where we're at, you're never going to get ahead. So, we always need to push the envelope.
Yeah, that's great. I think it's great.
Well, so let's start at the beginning. Just a little bit of background. How did you first become interested in dentistry? Where'd you go to dental school? And, let's start there.
All right. No, that sounds fair. Actually, I went to school not too far from where your lab is, Southern California. I went to USC graduated back in 1987. So wow. 35 years ago. How did I get into it? My father was a dentist before that. And cool. It's probably one of the reasons why I wasn't going to become a dentist, because my father was a dentist and he never made me feel like I had to become a dentist or anything like that. But I think I always felt like my strengths were more in the sciences, and I went to UC Davis for my undergrad.
So did I.
Did you? All right.
Yeah.
Two great minds.
Right.
But I was an animal physiology major, and as I got into my junior year, I still hadn't made my decision of which career path I was going to take. Mm-hmm. And I thought, you either stay in school, you teach, you do research, or you go into a health profession. And then back then, I looked at dentistry as kind of a nice way to be able to serve others where you could work in your own practice and have a little bit more control of your life. And so I like that. I got into dentistry, not even though my father was a dentist, I got there in the first week in dental school when they handed us these little wax blocks.
Right.
And a picture, and they said, okay, you're going to make that. I was like, I have no idea how to do that.
Yeah.
I go, I better find a good lab tech when I get out of school.
Oh my gosh. Our career, our educational backgrounds are strikingly similar. I mean, I went to UC Davis as well. My father was a dentist, and I remember being in my junior year at Davis, and it was, the summer before, the fall quarter started. And I went back and he was like, okay, well, you know what, let's, try to narrow your scope here, what we want to do. And I went into his office for 2 weeks, and man, I thought before those 2 weeks that I might like to, be a dentist, but I heard every single patient like just say how wonderful he was. And I left that 2 weeks thinking, my God, I can never live up to their expectations. I'm going to fail miserably, and that's going to be that. And I'm going to have a miserable life. So he kind of he steered me into the lab tech side of things. And, I'm forever grateful for that. But, that's so cool that you followed in your father's footsteps.
Yeah. No, that's a great influence your dad had on you too. It's all worked out very, very well. And well, as we go through this, I'll explain to you more about how that all panned out over 35 years.
Awesome. So you graduated from SC, and what was your first job like?
So the first job was going back and working with my dad in Sacramento. So I was born and raised in Sacramento.
Okay.
And so I moved back to Sacramento after the days living in LA. And for the first 7 years, I worked as an associate in his practice. But during that time, I was getting more involved with occlusion, especially because I thought at that point, 35 years ago, I thought dental implants were kind of an exciting area to kind of venture into. So I thought that was going to be my main focus. And as I went to more courses on implants, they said, hey, it's a great service to offer your patients, but restoratively, they will fail if you don't load them right. And it was all about occlusion. At that point, I knew nothing about occlusion. Most of us get through dental school and we get out, and even though we're working on teeth, we really don't understand how the teeth work. So I started taking Peter Dawson's courses and got really into CR and everything like that, and doing more comprehensive treatment planning. And so I actually left my father's practice at that point and started my own practice. And so that, again, from a father-son relationship, it's tough when dad sees you kind of stepping out, but I just wanted a different type of practice. And I think it was a good decision. Then after that, I did that for another 7-8 years. And then I actually moved out to Las Vegas. There's an institute out there, and I taught out there full time for 12 years, worked with some great dentists out there, both in aesthetics and occlusion. And then I left that when my youngest son was born. And just to kind of calm down, I thought I wanted to go back into private practice, but I got sucked back into corporate, became an editor of Dental Magazine, vice president at a small company called Discus Dental back in the day. So I had a chance.
Not that small.
Yeah. So I had a chance to work with guys like Bill Dorfman.
Sure.
And then from after that, we sold that off to Philips Oral Healthcare. And I moved back up to Sacramento. And I was just helping my dad out at that point. He was in his late 70s, and I had no intention to get into another practice. I'd had, I think, 5 at that point. And then I got pulled back into corporate, had a chance to work at Danville Materials with Dr. Ray Bertolotti, who was a great influence. I really always respected over my career. And then I ended up, I purchased my father's practice and went that step. And then right now I have a chance, and kind of still in corporate education, and I have my own practice still. So working with the company now, Vista Apex, and John Kinka, who's an amazing clinician who's changed and revolutionized dentistry once again. So, when I look back 35 years, it hasn't been a boring 35 years, a lot of change, a lot of learning, as you were talking about. I think that's the value of the 35 years. And I've just been blessed. I tell my wife all the time that, not only do I have a chance to work with different companies or learn different things, but I've had a chance to work alongside, I think, some of the best. And now I'm teaching everything from implants to occlusion to aesthetics restorative. And I'm working with the inventor CEO of this implant system that I really like. So I've just been really lucky to kind of have the career that I've had.
I don't think it's all luck. I think a lot of it is your passion and your work ethic. And that really shows through in everything you've done. And with my interactions with you thus far, I mean, everything is prepared. I mean, you have a plan and you spend time thinking and planning these events out, and you get fantastic results, and nothing happens by accident. I guarantee you, these companies recognize your mind and your work ethic, and they are honored to have you as a part of their team. I know that, and you're passing all your information down to the next generation. And that is just a wonderful, wonderful thing you're doing for this profession.
Yeah, well, thanks. That's what I'm hoping we're able to do. I before we did this, I was telling you, I was down in LA this weekend teaching an occlusion course for 2 days, Friday and Saturday.
So where were you exactly, and who was the host?
Oh, it was hosted by a company called Miyasaki based out of Seattle. And yeah, we were down in Costa Mesa, right by South Coast Plaza down there. And
was that at the Benko showroom or?
Oh, I've taught courses there. That's a really nice facility. This was actually just in a hotel.
Okay.
On Plaza over there. It's more of a hands-on course. So we had about 20 clinicians. And the great thing is we had clinicians from Dubai, Palestine, India, Canada, all over out of the 20 clinicians that we had there.
That's really cool.
And, they asked, well, why do you do this? I said, because there's a part of dentistry that's kind of an art. And if you stop, it's going to kind of die right there. So those of us that are kind of involved with this, we just kind of keep at it to pass it down to the next generations, I guess.
Right. And occlusion is one of those topics. Boy, I would say it's vastly misunderstood, at the dental professional level. And, we have 850 customers. And I think if I took a poll on the number one topic of confusion, it would be occlusion.
Yeah.
And, there's so many different schools of thought. Who do you follow? I mean, I was fortunate enough to, go through the COIS continuum. I have seven series of courses up there. And occlusion. I mean, there were 2 of the 7 were devoted to occlusion. It was just fantastic.
Yeah. Well, going to SC, we were trained nathologically. And then going Dawson, that he was, truly CR. And then now with the neuromuscular, I think you can take all 3, take the commonalities and really build upon that. I was telling the doctors I was with, really what the courses I do, we call layered learning. You don't have to give up what you're already doing or what you already know, but hopefully we can add a layer onto that just helps to clarify things.
That's perfect. Yeah, that's perfect. So you're now working with Vista Apex, and I'm thrilled because I've been a big fan. John Kanka is one of my personal mentors. He's taught me so much about restorative dentistry over the past, really, I think it's 16 years. And I've seen his slides of before and afters, and, he'll pause it and zoom it up 1,000-fold. And, this is what you did wrong here. And, I used to take it like, wow, I suck. But now I just view it as he's just trying to teach me how to do things better.
Yeah. No, John's pretty open and honest with you. But that makes him a great teacher. People can't just tell you doing anything perfect. You'll never get better. So when they point out these little things, that's what really pushes us to get better.
Yep, absolutely. So when did you first meet him?
John and I probably crossed paths like over 20 years ago.
Oh, wow.
At some of the KOL events that we attended. I know one of them was at Winnewaukee at a 3M KOL retreat. And that's where I learned he loves champagne. So he and I have we did some webinars, reportings last year, and it was all based around his love of champagne. I think that's, it's one of the small things in life that he just really found pleasure in. And so he just says, hey, that's what he's going to partake in. And he's a great clinician, smart guy. And, those clinicians years ago that fought the battles to make all of us better clinicians and gave us the chance of having the success we have today by fighting those that said you couldn't put acid even on dentin.
Right. Yeah.
And, today, if we didn't have acid etching of some sort, we would still be placing amalgams and gold restoration. So it was his fortitude to do the research, to feel the solid conviction that the research was right, and then to keep pushing us to kind of get out of the paradigm that was at the top at that point and push his to the top, which is the correct one. I think that's just amazing. I have great admiration and respect for Dr. Kanka.
Oh, absolutely. And I mean, most dental labs, if they have any sort of warranty, might even be out of business because the restorations would never stay in place. And
that's right.
Patients would bite down and crack them, and we'd be faced with so many more remakes. So I'm forever grateful for his research and, the ability to bond the restorations we make in a predictable manner. So it's fantastic. I hope you're going to be demonstrating, showing and discussing a couple of those points at your lecture here next month on October 21st.
Yeah, we're going to be going through everything from, hopefully this presentation will be kind of an all-encompassing presentation. We'll start with direct, talk about direct and indirect and how to have greater success. When we go talk about direct, we're going to be talking about some of the bioactive materials that have really changed the way that I practice and talk to my patients. And if you really talk to your patients about some of these bioactive materials and the benefits that they afford us, I've had patients tell me, I would pay more for that. And I tell them, you don't have to pay more. We just want to make sure we're using the best materials that are out there. And they're very appreciative of that. And the group I was teaching this weekend, we are a fee for service practice. And I was telling them, when you go fee for service, you have to have something a little bit extra that patients are willing to possibly pay a little bit more to stay in your practice because they're not going to maybe have the same level of reimbursement from the insurance. And it's every little thing you do to build that value. And that's what we'll talk about during the presentation. We're using more zirconia, obviously. And if we can use zirconia restorations that are full coverage or partial coverage and know that we can have them stay on the teeth, that's going to be a great benefit. None of us like those short second molar preparations where you put a zirconia crown on there and the patient says they were chewing a piece of bread and it got pulled out.
Right.
So we'll go through. There's a lot of misconceptions I think that we have about zirconia. So we'll cover all that.
Yeah, when zirconia first became popular in our industry, we couldn't really bond to it, and a lot of the surface was just so dense, and if you put acid on it, all you did really was make it smooth. But
contaminate it.
You contaminate it really, but. With the Vista Apex materials, with ZRC and ZRP, I mean, many of our customers have used this new material used Vista Apex new materials with great success. And I think, if we can get the word out there for, shorter, clinically shorter teeth and clinically shorter preps, you can actually achieve a very strong bond of the zirconia restoration to the tooth. It's brilliant, and it'll solve a lot of problems.
Yeah, absolutely.
So tell me, what are some of your favorite materials to use? What do you use most frequently in your restorative armamentarium?
Oh, I'll tell you from a Vista Apex point of view. So Vista Apex really quickly has a lot of restorative products and a lot of endodontic products. So when it comes down to endo, their irrigants, their ultrasonic activation of the irrigants we put into the canals have really improved my root canals. But we want to try to avoid root canals. So when we place our restorations, we want them to be sensitivity free and well fitting. And I will tell you, I don't know what I could give up today. Some of my favorite things are, and I was just having a conversation with another person in the industry about composite warming. When I do my direct composite restorations, I love warm composite. And this person was saying, well, a lot of docs don't use warm composite. And I said, I know that, it's probably like 30% of docs will use composite warmers. But in my practice, we use CompU as a composite. And if it's not warmed up, I kind of take the gun and kind of hesitantly, and my assistants know I'm not going to be a happy camper. And when it's warmed up, we get improved physical properties of the composite. We get better adaptability. It's just, when you think about it, if we had
fewer voids,
yeah, everything's just better if you warm it up. We get less polymerization, shrinkage, stresses. We get deeper depth of cure, better conversion. Everything's better. And then once I get my composite in, seam free, which is just a composite wetting resin, is just one of my favorite things because I just don't like my instrument sticking to the composite, pulling it off of the tooth or putting a layer between my layers of composite, and seam free won't do that. So those are just like the everyday things. We've got the curing light that's called the pink wave. So instead of being just the blue light, it has 4 different wavelengths. And we get better depth of cure. We get less polymerization shrinkage. And it's just a fabulous light, the pink wave. And then going back to our restorative materials, we have now Regen adhesive and Regen flowable composite liner. And these are materials that are truly bioactive because they contain a bioglass that releases calcium, phosphorus, and fluorides, but it also attracts them, helps to seal up any micro gaps. But the bioglass actually, I believe, helps the tooth heal up because it creates an appetitic-like material on any surface it's placed against. So, I have these deep class 2 restorations where I can almost see the pulp. You got that red eye staring at you. And I know that if I use the regen adhesive and the flowable composite liner, that we're going to be okay. So there are a lot of products that Vista Apex makes that I use throughout my practice today.
Oh, that's really cool. Wow. Great endorsement. But also, I mean, it's better for the patient. You're choosing these materials and these restorative strategies with your patient's best interest at heart. And I know they're not cheap, and I know you're not charging your patient any extra for it, but you're doing right by your patient. And in those terms, I mean, you've sent us a fantastic case, and let's just call her Mrs. Jones so we don't violate anything here. Man, when I first saw this, I looked and I was like, wow, there are all restorative elements are in this case. It's fantastic. Why don't you tell us briefly, how Mrs. Jones presented to your office and, the different sorts of treatment plans that you went through and what you finally decided on?
Yeah, she is kind of a patient that all of us see in our practices all the time. She's a little bit older, not old, but maybe 50s, 60s, and no toothache pain, but she had some periodontal involvement of tooth number 10 and 11. And when we looked at those, they were becoming mobile, and she wanted a nicer smile. So I was kind of trying to figure out how we're going to do that. To veneer teeth that are periodontally involved, we didn't want to do that. To do bridges up there, we didn't want to do that because the adjacent abutment teeth would be compromised also. So, and again, looking at this case, we were not setting this case up to be a showcase type of case or anything like that. We started this case a couple of years ago. We had to extract 10, 11, put some implants up in that area. Again, the bone that we had to work with in that area wasn't great bone. I knew that was going to be a challenge. And so we had the opportunity to do this program with Keating, and we had that case ready to go and said, okay, we're going to send it to the best. And, the nice thing is I know you know how to work with the implant system that we used with this case. We're planning to do a lot in zirconia because we took a lot of old restorations off, a lot of old crowns. We had some areas on the bicuspids where we just had large direct restoration. So instead of doing full coverage crowns, we went with partial coverage, kind of a veneer onlay type of restoration. And then
they're fantastic preps. I mean, just beautiful still for not much tooth structure, remaining incredibly mechanically retentive preparations. And it's fantastic.
Oh, no, thanks. And I know I threw you guys some curves because the implants, they're pretty close because the space that we had in that 7 to 11 area was pretty narrow. But I know that you guys can handle that and help me out with it a lot. So what we did was we prepared everything out. We'll have everything from crowns, implant crowns, and partial coverage with zirconia. So we'll be able to show how the ZRC and ZRP work and the trust that we have in those products. And where the implants were placed, we had to do a little bit of tissue recontouring in that area. So I'm trying to maximize our tissue thickness, and we'll see how that looks. And no, I'm excited. She's excited. When we weren't planning to have this as a showcase type of case or anything like that. So I started off with her pre-op models, and I didn't have a diagnostic wax up of her case done. And we made the temporaries and did a little bit of recontouring once the temporaries were made. And, she's one of those cases where she's so appreciative that when she held the mirror to look at her temporaries, she just fell in love with the temporaries. And so it's just so nice to have patients that really appreciate what the challenges that they bring to us, and then, the improvements that we can make for them. So she's a great patient, a great lady. And I know we'll be able to give her something that she's really happy with. Oh,
absolutely. And you did. I mean, you gave us the model and the measurements, and you created the blueprint for us to follow. And we're going to have some photos for you to view tomorrow. I'll send you a set of images, and you'll be able to view the case in the bespoke stage, and, let me know your thoughts, and then we'll put some finishing touches on it, and you'll have it by the end of the week.
All right. No, I appreciate that. One thing that I'm noticing, we're just a family practice. We're in Sacramento, California. We're not in a big metropolitan city, and we really are a family practice. And what I'm seeing is just an uptick in the number of these cases that are coming through our practice. And we don't do any special marketing or anything like that. We plan to do some, but we're not really doing any right now. So, I really hope that during the course that we do down at the lab, that we're able to talk about maybe how people who want to do more of these cases, set these cases up, how they talk to the patients about this. And then for sure, we'll go through actually the clinical steps of accomplishing a case like this. So I'm looking forward to being in the audience when the course goes on at the lab.
Well, that's so cool. I mean, and I know this is really this is like an everyday type of case that, comes into your office. You have quite a following and your reputation is obviously tremendous, and I know you didn't mean this to be a showcase for Keating, but man, this is just, I mean, your level of thought and your level of planning to achieve a successful final outcome. I know we're going to nail this on the first attempt, but I mean, all the steps and all the hours you've put in to this before it gets delivered next week is just tremendous.
Yeah, well, thank you. It's just been, again, I've been lucky to have really good mentors throughout my career that just helped me think all this through, and working with great labs, I think is so important, because if I could do the same thing and give it to another lab who does not have the skills and education and knowledge that you have, and it would not turn out like this case will. So no, again, I just really applaud you and your team of technicians and just the way you run the lab with the integrity that you do. And I feel really comfortable working with you.
Oh, doctor, thank you so much. That's very kind of you to say. I know I've taken up far too much of your time. I know you're a busy man, and I know you probably have about 85 other things to accomplish this afternoon. But again, I thank you for hosting a wonderful course. The details will be in the write-up to this podcast. Our listeners can go to Keating Dental Lab's website or Vista Apex Materials website to register for the course. We have room for about 50, so let's make sure that you guys get your reservations in early, because this one's going to sell out. This one's going to sell out soon once we really start advertising it.
No, thank you very much. And yeah, I hope to see everybody that signs up there, and I'm really looking forward to this. We're going to give it our best.
Awesome. Well, Dr. Miyasaki, thank you so much for your time. Thank you for being so gracious and for being such a wonderful mentor to all of us. And I look forward to seeing you live in person next month. It's too bad SC has a bye week that week, or we could go see a game on October 22nd.
Oh, bummer. Okay. No,
you want to come down this weekend? We got some extra tickets for Fresno State.
Oh, really? Okay.
Yeah.
Well, you know what? That's on Saturday or Sunday?
Saturday. It's a late game. It's a 7:30 kickoff.
Yeah. My wife is having a surprise party for somebody, so I can't. But thanks very much.
Awesome. Well, hey, anytime, come on down.
Thank you.
Okay.
Thank you again for the opportunity. This is great to share.
Awesome. Well, thank you, doctor. Have a wonderful day.
Thanks, Bob. Take care.
Okay. Take care.
Thank you for listening to the Dental Up podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.